Often our patients who were admitted have already fallen prior to coming into hospital, and many of them have fractured neck of femur, so they're actually a very high risk group. And in this time we've seen quite a considerable reduction in falls, and we've gone down now to last month to 2 falls, and up until the weekend we were 35 days fall free on Ward 3B, which is a great achievement. Clearly the work that we have done has had a huge impact on patient safety.
This Fall Safe Project board is exactly the same on 6B. Here we've got a list of the medications that are high risk for patients, potential of falls. Communication plan displayed on here for everybody to see. We've got a really good poster to demonstrate how to measure a line and standing blood pressure, so the staff, if they're unsure or new to the ward, have got this at hand to review. We've also got our PDSA cycle, and finally one of the most important pieces is the measles diagram here, which demonstrates if where the patients actually fall in relation to the ward area. And what this does is highlight at-risk areas on the ward. So if a patient falls in one particular room over and over, is there something we need to be doing, looking in that area to try and reduce any further falls?
Yes, it's made it a lot easier. We can identify patients immediately. You don't have to necessarily go through the notes. You can walk into a bay. Straight away you can see, we use these yellow stickers that go behind the bed spaces. If the patient's out of bed or getting out of bed and they have socks on, they're having the yellow socks now. And they also have the wristband which goes on the patient, so we can see straight away that they are risk at falls. So that is a brilliant idea. Pop behind the bed, instant, you can see who we need to watch and what the risks are involved around them. When you go into the workbook, it actually gives you a little bit more information and details, like ages of people, like over 65 or more, you know, subject to falls. We are actually a trauma ward here anyway, so some of our patients have come in as they've had a fall, so obviously they could be a little bit more vulnerable, if you like. So we have to specialise, but this has made you more aware of what to look for in a patient, you know, very easy to work through, and it does give you a little bit more information to make you more aware, really.
And part of some of the work that we've done is looking at obviously preventing falls rather than reacting to falls, and part of that is the correct risk assessment of the patient. That includes doing the multifactorial risk assessment when the patient arrives in hospital in a timely manner within 4 hours. If the patient is deemed as a potential high risk of falls, we then move on to something called a risk assessment, and we'll then look at the most appropriate place for that patient, whether it be cohorting in a high visibility room with extra support of staff and supervision, or whether we actually require additional staff to come in and look after that patient. So with this risk assessment, we do have some documentation that does within the first 24 hours of the patient assessment, and this looks at their behaviour and emotions, and then we can do a good assessment the following day of whether this needs to continue or not.
At the beginning of the project we did an audit. What were the most frequent medications that can cause falls? The 10 most frequent medications. We have done a list and it's laminated and goes in the medication trolley, so when the nurses are doing the rounds they have the list there so they can check. It's making everybody more aware of these medications. The nurses are prompting the doctors to change these medications and being more cautious in the patients that has them, also if that make them be more at risk.
It's made the whole of the team, physiotherapists and occupational therapists, more aware of addressing patients who are at risk of falling. As occupational therapists, we use what's called a false risk identifier, which we've utilized more often now to identify the reasons why patients fall, and we make recommendations to appropriate agencies so that this can be addressed further after their hospital stay.
To enable all the staff to safely perform a line and standing blood pressure, they've all been trained, been on a training session to demonstrate exactly the process. We also have some posters displayed around the ward as to the correct process of line and standing blood pressures, and we're expecting 100% compliance each month. So when we first started this project, we were at 0% for our patients having a line and standing blood pressure, but what the staff are aware now, they can do actually a line and sitting blood pressure rather than have to do a line and standing. And actually for the last month we got 100% compliance for every patient on the ward that has had a line standing blood pressure, and we hope to sustain that.
We'd like to roll this out across the trust. We'd like all wards to have a reduction in falls. And we've got many ideas that we're currently implementing. One of them is doing a urinalysis sticker that is actually the same themed colour, it's yellow, so it'll go in the patient's notes. Again, that's one of the tests that often gets missed, which can indicate if a patient is a high risk of falls. To start is what we've called a swarm team, in which we've got a group of multidisciplinary team members who will go to a fall as soon as it's occurred. And at that point they can have a look at the timeline of events, how it's happened, if there's anything that we need to review there and then, to ensure that all the paperwork's updated and risk assessments completed. And obviously that very important duty of candour is done also for the patient and the family. We will roll out across the floor onto 3A and onto 6A, and then we'll move both upwards and down to our colleagues on site in Lincoln and at Grantham also.
Falls is everyone's responsibility.